hope you're joining me live today at 11 a.m. on Apollo 24/7's Health Hour. Together, let's talk how to beat COVID. A senior doctor from Apollo Hospitals, Dr. Ravi, along with other co-victors who have fought and defeated COVID virus, are going to talk to us live. So join me at 11 a.m. sharp. I hope you're joining me live today at 11 a.m. on Apollo 24/7's Health Hour. Together, let's talk how to beat COVID. A senior doctor from Apollo Hospitals, Dr. Ravi, along with other co-victors who have fought and defeated COVID virus, are going to talk to us live. So join me at 11 a.m. sharp. I hope you're joining me live today at 11 a.m. on Apollo 24/7's Health Hour. Together, let's talk how to beat COVID. A senior doctor from Apollo Hospitals, Dr. Ravi, along with other co-victors who have fought and defeated COVID virus, are going to talk to us live. So join me at 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. Indeed, this Health Hour has made me so strong. I should admit that talking and preparing and being aware has made me a different person to accept challenges. We all have been facing different kind of issues. That could be health, it could be psychological, it could be financial, but COVID has put us all into restricted zones. But Apollo 24/7 has at least helped us in many ways where you can be relaxed with your healthcare. Getting all the healthcare requirements into one app, into one strength of your arm, that is your actually a thumb, I must say. That is an app which is in your phone, which will connect you to all the healthcare accessibilities. And I have used it. Trust me, if you have if you don't have the app, please download it right away because it helps me. And today in this show, I will share you how Apollo 24/7 app has helped me. So this is a show where Apollo Healthcare Network has designed to give you more awareness, give you more preparedness in facing the challenges that we are facing. So co-victors. We have COVID everywhere. We are seeing a lot of stories. And co-victors are somebody who are special, who have beaten Corona, who have defeated Corona and come back to give us their stories. Today's Health Hour, we are going to meet a few co-victors and an expert doctor who himself is a co-victor who's going to share his story in a while. And we are going to gain experience and be prepared to face this pandemic. In the show, I'm going to ask you a few questions. There's a health quiz where exciting questions and gifts are waiting for you. The best part of the show is that you can participate. Please go ahead and type all your questions and queries in the chat box. I shall take up these questions with the expert and as well as the participants of the day. So let's start. Be with us till the end of the show where you can win coupons and discount vouchers as well. Let's start today's show with our co-victors. Today, I'm going to have 2 co-victors, people who have defeated COVID-19. One is Mr. Amol Kedare, who's a banker from Mumbai, and Mr. Suchita Basu, who's from Kolkata, who's a healthcare professional. Let me welcome our co-victors, Mr. Basu, and welcome Amol ji. Can we have you? Good morning.
Good morning. Namaskar.
Yes, Mr. Basu, namaskar, and Mr. Amol, namaste. Welcome to the show.
Thank you. Thank you very much.
Yes, it is so good to see you both here. Thank you so much for joining us. As I was just saying, COVID तो हर घर पे भी दरवाजे पे एक हमारे घर पे भी knock किया है. So we are going through this. So I understand what you must have gone through. But congratulations on defeating it. Congratulations on being a co-victor. Yeah. So let me start with Mr. Amolji. Amolji, you are from Mumbai. I understand that you are working with a banker. So what happened to you? When did you realize that you went through COVID? What were the symptoms?
Well, the story goes this way. It's actually a little dramatic story. I was having a pain in the kidney. I got it diagnosed via sonography, and I got to know that there are like 4 to 5 stones in my kidney, along with the kidney swelling. So I took that report to my stone clinic, and the doctor recommended me to go through laparoscopic surgery. But since it was a non-COVID hospital, he asked me to get the COVID test done before I get admitted. So yeah, I did my COVID test, and unfortunately, it came out to be positive.
Okay, that's nice. So, in a way, that kidney stones have led you to identify that you have corona. So, what was your state of mind at that point? Where how did you react to this? Which was more important, the kidney stones was hitting you more, or the COVID hit you more?
Oh, well, the thing is like I was in a dilemma. I was in a shock, and the kidney stone problem, the pain, the excruciating pain that I had was like 24/7, and I was suppressing it with the painkillers, all the time, and so that's how I was in a shock. But then things went good. I contacted my reporting manager. I told him about my issue, and then I got quarantined myself in a hotel, wherein the Apollo doctors took care of me.
Oh, wonderful. So, you use the Apollo Coverage Stay at Home program. I'm sorry, the Stay at Hotel program.
Yes, yes, that's right.
All right. So, how was the stay and how were you monitored? You know, at home, I understand you will have caregivers and support structure. At hospital, you have a different structure. But how was it at the hotel? Staying and would doctors in connect with you?
Yes, the doctors were connected with me all the time, and they were like through three channels. One of the doctor was connected with me online. The other was on the phone, and the third was physically coming daily to visit and having a check on my oxygen level, my temperature, and the symptoms that I'm going through, the medications that I'm having, and all of that.
Wonderful. So, how long was this, Mr. Amol?
The period was for 14 days.
Right. And
Could you say that again? I'm sorry.
what about the kidney stone treatment while you were quarantining for COVID? What happened to your kidney stones?
Well, that's a good question. When I Before I went to the quarantine facility, I consulted my stone doctor, and he gave me some medicines to suppress my pain for the time being, at least for the period that I'm quarantined for. And along with getting quarantined and getting treated for COVID, I also took my stone medicines along with me, which helped me to get rid of the pain and actually get rid of the stones. To be honest, in a span of 3 to 4 days itself.
Oh, wonderful. So, you didn't require a surgery later?
Oh, not at all. I didn't even feel the necessity of getting the sonography done again to see if my stones are there or not. You feel better when you feel better from inside, and you get rest assured that there's no issues in terms of kidney problems. So yeah.
ठीक दैट्स इंटरेस्टिंग। अच्छा, एक और बात मुझे पूछनी थी। वैसे आप जो आइसोलेट कर रहे थे जो होटल में, तो आपका खाना वगैरह एंड ऑल योर अदर आल्सो साइकोलॉजिकली यू मस्ट बी स्ट्रेस्ड, तो वो हाउ आर यू टेकन केयर ऑफ एट दैट पॉइंट?
The initial 3 to 4 days were a little stringent for me because I didn't know what's gonna happen. But then what I believed is to believe in myself and believe in the doctors because they are the best people to judge me, and I am also the best person to judge me. So yeah, I kept myself positive because I know that the problem that I'm going through is not going to be an easy one, but I have to sail with the flow. So yeah, I was quite positive. I consulted the doctors all the time, and I also kept on speaking with my nearest and dear ones, and got encouragement from them, got power from them. My colleagues were also very supportive. They used to call me daily. My seniors, they took care of me like a baby, and yeah, so things were went
So the
went
external support was nice. The family support was really good.
Exactly. Yes.
अच्छा तो this is like एक बार दो बार और एक तीर.
Yes, exactly. Exactly. Exactly.
Done. Acha Amolji, and what is it that you want to say? What is that one important and a practical tip that you would want to advise our viewers today?
Well, मैं एक चीज साफ साफ कहना चाहता हूँ लोगों को कि हम जब खास करके जब हमारे मित्र परिवार हमारे ऑफिस में हम जाते हैं तो हम लोग वो प्रॉपर गियर नहीं पहनते. हम लोग जो प्रोटोकॉल है कोविड से बचने का वो हम फॉलो नहीं करते. मैंने अक्सर ज्यादा करके देखा है. इनफैक्ट मैं खुद भी एक उसी तरह का बंदा था जो ऑफिस में जाने के बाद या तो फिर घर पे जाने के बाद या तो दोस्तों के पास जाने के बाद वी टेंड टू take our gears off. We don't sanitize our hands. We hug them. So वो चीज हमें ज्यादा अच्छे से पालनी चाहिए. खास करके जो हमारे एल्डर लोग हैं हमारे घर पे, हमारे दोस्तों मित्र परिवारों के घर पे, वो उन लोग तो बाहर निकले भी नहीं है फिर भी उन्हें कोविड कैसे हो रहा है. तो ये हमारी जो हलगर्जी है इसे हमें काबू पाना है जिससे हम और हमारे परिवार को सुरक्षित रख सके.
Wonderful. So never leave your guard. हमेशा बच के रहना और तैयार रहना. That is what Mr. Amol has to say. And कोलकाता से हमारे पास है Mr. Suchita Basu, who is a healthcare professional जो healthcare में थे पर never did he imagine contract COVID. Namaste, Mr. Basu. Welcome once again. Achha, Basu ji, I understand that you come from a healthcare profession.
Yes, ma'am.
So, how did you react, and what was your story of initial understanding?
Okay, first of all, I like to I'm really thankful to my family members as well as the doctors and consultants of Apollo Clinical Hospital. I am here only for them. So initially, I got fever for the last 2-3 days. I took Agitral as I'm totally a diabetic patient, as you to add on, and I was taking insulin also. So for the first 3 days, I took Agitral and also some medicines. As my brother is also a doctor, own brother, so he recommended me to take to hospital. First, I went to a diagnostic clinic where chest X-ray was done. Then he insisted me to go to Apollo Clinicals Hospital, Kolkata, which is very near to me. So then I got my CT done, and immediately I was taken into the triage of the room where the doctors intimated me that I am having a bad type of pneumonia. So then an ambulance came. It was really
very fast.
It was very fast.
Very fast. A matter of few
it took around 2 to 3 hours for getting me transferred to the triage isolation room, because they tested all my from all ends. They diagnosed me. Then they were positive. They were confident that I was positive in COVID. So I got into the isolation room, and then they made me BiPAC, and all the things were done to me.
So you required emergency medication. It's not like where Amolji was isolating in a hotel, but आपको तो emergency medication की जरूरत थी.
Exactly. हमको emergency medicines, all the things where channels were gone. They gave me antibiotics and all this. And the team of doctors and the pulmonologists immediately assisted me. They were very care. I got confidence from my family also. I was really in a bit of fear. I was panic at that time. I was thinking about my family and my aged mother, who is now down in cerebral time. So then I was there in 14 days there for the first. Then I got discharged from the hospital, and there were 3 instructions which I followed really, which the doctors advise, which I'm.
Like what? Other than the medication, did they give you any specific instructions?
Yeah, that I followed strictly. That's why I'm here. So the first is lying on my stomach for at least 1.5 hours. Then lying on the sides for half an hour each on both sides. And then take deep breathing. And also walking inside outside the triage room. Outside the isolation room. So I maintained that. after I got discharged and I came to home. I strictly followed those advices of my consultants, and which paid me off from this disease.
So कोविड केसेस में ना हम लोग बहुत सारे देखते हैं कि काफी घर में हील हो जाते हैं, काफी तो मेडिकेशंस के साथ हील हो जाते हैं, and a few like you require emergency help. Yes. But then beating it there, being there, and at that level, it must have been really stressful for you. How did you deal with that?
Yeah, it was really the empathy which I received from my colleagues and also my management staffs as well as my family members. It's huge. They boosted up me like anything. And main thing, I was never panicked. Yeah, I was really nervous, but I didn't get really panicked. And when panic was coming to me, I was just telling that I have to survive. I have to look for my family. That self boost up confidence was there in me.
So, दोनों के स्टोरीज पे हमें यही पता चलता है कि पैनिक का कोई जगह है ही नहीं. विल पावर एंड पॉजिटिविटी इज द मोस्ट इम्पोर्टेंट थिंग हियर. ग्रेट. एक और मिस्टर सुचिता बासु को कमेंड करना एक जरूरी बात है. where there was a necessity of giving space for a next important and emergency patient, you chose to, because you were more stable. When doctors requested, you said yes to give the ventilator.
Yes, I got out of my isolation room. I paved way to another ventilated patient who was very critical, and that very patient survived. And I received a lot of thanks from my management staff as well as from the doctors. Because wonderful. It's my duty, it's my moral duty to serve them as being a healthcare professional.
Great. So आपने Apollo 24/7 ऐप से आपके कंसल्ट्स किए हैं. So yes. Your entire अमोल जी ने अपोलो कवच प्रोग्राम यूज किया था और आपने अपोलो 24/7 ऐप से कंसल्ट किया था.
हाँ जी.
How was the experience there, sir?
Yeah, it was really communicating. The doctors were the consultants was they were answering to all my queries and questions. They even talked to my family members directly at late night also. So I was really thankful and grateful to the management staff as well as to the management staff and doctor consultations.
So इतना जो gain किया है, what is that one important tip that you want to share with our viewers?
Yeah, the one important thing that please don't get panicked. If you get panicked, so less self boost, a boost of confidence should be there. I will get well. Another thing, strictly follow the doctor's advice. After getting discharged from the hospital or from the quarantine center, you just strictly follow the doctor's advice in the quarantine, in the home isolation days also.
Wonderful. So that's it. Jo Amol ji and Suchita Basu ji, you have a great story and great experience which will help a lot of people to deal with this. Thank you, and I request you both to be with Amin on the show. If our viewers want to ask a few questions, they will definitely ask a few questions, and I'll request you to be back on the show. Thank you so much.
Thank you very much.
Right. So this is the story. Be prepared or panic nahi karna hai. Thank you. I request you both to switch your cameras off and audio off as well. And now to move on, I am going to introduce you another co-victor, a person who has defeated COVID. He's just not a co-victor. He is a doctor who treated COVID. And this doctor is now a co-victor. I now call him the hero of the show. He is Dr. Victor. Dr. Ravi Andrews, who's a very leading nephrologist, senior consultant nephrologist at Apollo Hospitals, Jubilee Hills, Hyderabad, who specializes in nephrology and internal medicine, who has more than 20 years of experience in the field. And he's one of the 3 nephrologists in the country to perform third kidney transplant on the same recipient. And the first nephrologist in AP and Telangana to perform a swap kidney transplant in July 2014 to add more feathers to his cap. He's rated the best nephrologist in Hyderabad since January 2012 till date on the online portal www.ratemds.com. And here's our hero, Dr. Victor, Dr. Ravi Andrews. Welcome once again, sir. Namaste.
Namaste, everybody, and good morning to all. Welcome to another episode of Apollo 24/7 Health Hour.
Yes, doctor.
As we are fighting this war against COVID-19, let me tell you that we can win this battle. We can defeat this virus because of our ever-increasing knowledge, our positive attitude, and unity. I have personally fought COVID virus on different fronts. First, as a frontline warrior, as a co-warrior. I was treating patients who had COVID-19 infections. Then I myself got infected and fought it as a victim, as a co-victim. And then I defeated the virus, and now I'm a co-victor, and I'm fighting this virus on various social media platforms. The main goal is to remove the myths and the misconceptions about this virus. And yes, I've got back to the hospital as well. I'm a co-warrior again, and I'm going to continue this cycle until either we get a vaccine or this virus is completely destroyed.
Great.
Now, my COVID story began in March when the lockdown was announced. And at that time, Apollo Hospitals Hyderabad was the only hospital in Hyderabad that was allowed by the government to admit and take care of COVID-19 patients. Now, since dialysis patients have a very high risk of getting COVID infections, that too, and also COVID-19 patients have a high chance of getting new onset kidney disease, I knew, mujhe pata tha that I was going to get, probably I'm going to see a lot of COVID-19 patients, and there's a high possibility that I myself could get infected. Of course, all precautions were taken. The hospital made a separate hospital, COVID hospital, only to cater to COVID patients. All the social distancing norms were formed. The masks were used, sanitizers were used, and Apollo 24/7 was launched. And this formed a very, very high quality level for doing telemedicine. And this decongested the OPDs a lot. Patients could sit at home and communicate with their doctors. The doctors didn't have to see lots of patients at one time. In spite of all this, when we could do more testing, when we had more testing kits available and we could do more testing, I found out in mid-June, suddenly on one day, that out of the 35 patients that I was seeing, 9 of them were COVID positive. I had been exposed to a very high viral load. And sure enough, on the 21st of June, I developed the typical symptoms of COVID-19 infection. I had fever, I had headache, cough, sore throat, a runny nose, abdominal pain, loose motions, red eyes, loss of taste, loss of smell, the whole gamut. And I knew, mujhe pata tha ki mere ko infection ho gayi. I went home after giving the test, of course. I went home and I isolated myself. I packed a little suitcase with 14 days worth of clothes in it. I went into a room with an attached bathroom. I only had my phone, a few books, and my laptop for company, and I just shut myself in the room. Food was delivered at the door. A code knock was given. I would open the door like a thief, go get it in, eat it, and leave the plate outside. This went on. I thought, मैं सोचा कि मैं डॉक्टर हूँ, मैं मैनेज कर सकता हूँ, सब मालूम है मुझे. मैं overconfident था at that point in time. And for the first 5 days, 6 days, I did not improve, but I did not worsen. So I thought it's okay. Then suddenly, on the 30th of June, I developed a new symptom. I started getting chest pain when I was taking a deep breath. And by evening, I was breathless and I was gasping. I called up the hospital. They said, get admitted immediately. And I was scared because as a doctor, I know both sides of the story. I know that COVID-19 doesn't have a specific treatment. And I know that if I am very breathless, I might go on a ventilator. And एक बार ventilator पे गया तो 50-50 chance है ventilator से निकलने के लिए. ये सब सोच के मेरे को बहुत डर लगा. लेकिन मुझे तो और कुछ करना था, hospital तो जाना ही था. So I just looked around my house, I thought to myself, will I ever be coming back here again? I looked back at my family and thought, will I ever see them again? And with that attitude, I went to the hospital. Immediately, the treatment was started, and everything, remdesivir, tocilizumab, steroids, whatever was available at that time was thrown at me. For the first 48 hours, I was not well. I did not improve. My oxygen levels were 80%, normal being more than 95%. Still, at one point in time, I had almost given up. I said, I'm not going to make it. I called up my wife and I gave her all my account details, saying that, thinking, maybe I'm not going to make it, so you need to take care of things. But somehow something inside me, when I was saying, why me, something inside me told me, when you had all things going well for you, when you got a good education, good family, good practice, then you did not ask why me. Why are you asking why me now? Get up and fight. Don't be a loser. And that changed things. The minute I thought that I'm not going to be a loser, I'm going to fight this, things started changing. My oxygen levels started improving. It's like a weight went off my chest. I started breathing better and I was feeling so much better. And 48 hours ke baad, I had got so much better. Oxygen level was minimal. I was able to at least move around in bed. And I thought, yes, Now I've made it. I have fought it out. And then I get another shock. I get a call from my wife saying that, look, I also got cough and I'm also admitted in the same ICU. And she was there too. Within 2 days of me getting admitted, she got the same treatment as me. Luckily, after 5 days, we were both better. We got shifted out of the ICU. We were in the wards for a couple of days. And on the 7th of July, we both got discharged and we got home and we are both better. We are both much, much, much better. And what made us win, what helped us to defeat this COVID? I think most of it was the positive attitude, because I can tell the point in time when my attitude became positive and things started changing. The other thing, of course, good treatment by good doctors at a good hospital, goodwill, God, of course, good luck, and a lot of goodwill from friends, family, patients, grit, guts, positive attitude. All this counts. But the point I'm trying to make today is, no matter how sick you are, no matter how bad the situation is, we can fight this infection. We have to do it together. We have to have a positive attitude. And we're all here together. All us co-victors are here together to explain to you how to defeat and how to fight this virus. And we will be happy to answer all your questions for you. Now, let me hand it over to Jhansi to take us forward.
Yes, doctor. And I must say, Mr. Mohan Dubey on the live chat has given you a salute, literally a hero, and thank you.
Thank you. Thank you, Mr. Dubey.
Yes, Mr. As others also were telling today, कि panic नहीं होना है, positive रहना है. You can beat it is the word for COVID. So I understand and I relate to your story from a caregiver's perspective. I have two people at home who have tested positive, my cook and my father, who's done so well. Touch wood, God's grace, and all the good wishes from the family and support. My father's doing really very well, home quarantining till now. With his age, it was. But I should say that being a caregiver has opened many doors. बहुत सारे क्वेश्चंस हैं, जैसे आपने आपके स्टोरी बताया था कि आप बहुत हल्की, only very little of the door that you were opening, you kind of shut yourself. But my father being an aged person, I had to keep an eye on him. So caregiver ka always that confusion and that question, am I correctly presenting myself to him? Am I contracting? What's my risk? So what would you advise a caregiver, doctor?
Now, a patient can be divided into two categories: somebody who can take care of himself and somebody who can't take care of himself. Now, the patient who can take care of himself, the caregiver doesn't have much of a role. They just stay as far away from him as possible, but ensure that he has all the equipment to take care of himself. That includes a pulse oximeter, a digital thermometer, a notepad to note things, gloves, masks, and all that. If the patient is somebody who cannot take care of himself, who's very old or who's got some cancer or some other problem, in this situation, the role of the caregiver is crucial. But the most important thing you need to remember as a caregiver is that you should make sure that you are safe. Because if you fall ill, then, you know, the whole thing is it's a pack of cards. It all falls down. So take care of yourself first. So minimize going out. Use all the SMS, the famous acronym of social distancing, masking, and hand washing, and try and minimize contact with the patient as much as possible. As far as possible, let him do things the way he can do. But if he can't, if you're going to meet him, then you have to go with all the protective kit. You have to, if you go in and be in contact with him, then you have to wear gloves, you'll have to wear a mask, you have to wear a cap, wear a gown if possible. And these PPE kits are very easily available anywhere in the market these days. So ensure that you do that, and every time you get in touch with him, discard all those things in an appropriate bag. For his food, identify a set of utensils which only he will use, and whenever you handle those utensils, you should be wearing gloves. And after you stop handling them, you make sure you wash them and then remove your gloves. The important thing, Jhansi, is to remember, take care of yourself.
Correct.
And it's all basic common sense. You don't need to do you don't need rocket science here. Basic common sense, and you'll be able to take care of yourself.
Perfect. And also the state of mind. जैसे आप बोल रहे थे कि once a co-victim, you have to be literally be watching out. No stress. The same thing applies to caregiver, is what I understood, that the caregiver also should not panic, also should consult the doctors on time. And Apollo 24/7 has helped me in consulting. I must admit that there.
Absolutely.
Right, and then all the supplies that you are mentioning, gloves, notebooks, everything together, Apollo has made a entire sanitation kit, the hygiene kit that they call, which is available and which I booked. That was very easy for me to do.
Yes.
Right. So, and one
Good.
last question on the caregivers aspect, medications and also right time पे emergency पे call लेना. You being a doctor, आपको पता था कि this is the time, red flag है, चलो भागो. So, how does one understand the red flags and how do I prepare myself to reach out to the hospital?
See, the most important red flag is the oxygen and the breathing. So the patient has a pulse oximeter. If the pulse oximeter shows an oxygen level of less than 90%, it's time to go to the hospital.
Okay.
90 to 93 to 94 also, he probably will need to go to the hospital, especially if he's an aged person and he's got other comorbidities. So your cutoff is 94%. Anything below 94, think about taking him to the hospital. And the other thing is the respiratory rate. If the breathing rate is more than 24 per minute, then again, these are red flags. Otherwise, the temperature going above 102, or he having a lot of vomiting, or he's uncomfortable in any way. If there's any doubt, the point I'm trying to make is if there's any doubt, if there's anything which is out of the ordinary, don't take a risk. Connect with your doctor, preferably on Apollo 24/7. Connect with him, take their advice. Identify one doctor. Don't take advice from 10 different people. Identify one person, trust him. Trust that guy. He's the one who's going, he's responsible for the patient. So trust him, identify him, call him on Apollo 24/7 and get the patient, take his advice and decide what to do. Don't take too many decisions on your own. If the doctor is there, he's available all the time. It's not like the olden days where you had to go to the OPD to see him. You Apollo 24/7 now. Just click a button, get in touch with him and take his advice.
Yes, doctor, I do agree there. And also one more thing, that you have to inform your hospital first. कि सीधा hospital मत चले जाओ. Get ready. Go through a proper channel.
Yes. And your doctor, your primary care doctor is obviously going to be attached to some hospital and he will take care of that.
Right. So that's it. This is from my story where I had taken care of him. He's done his 19 days of quarantine and he's doing
Wonderful.
well. Touch wood, God's praise, and all the doctors have helped us, in fact, the family. Thank you.
Excellent.
And we also are in the co-victors gallery now.
Oh, wonderful. Yeah.
Done.
A lot of the credit
Doctor,
goes
lot
to
of
you
questions?
too.
Yes,
Yes.
doctor.
I said a lot of the credit goes to you too.
Yes, I do accept that too. Thank you. Yes. A lot of questions. So let me start
Let's
from the
shoot.
beginning.
Yes.
Namaste. Anil Arora ji पूछ रहे हैं, when I go for a walk in a park, is there a risk to sit or touch a bench or a surface in the park?
Arora ji, one thing is walking outside, बाहर घूमने से कोई risk नहीं है. As far as surfaces are concerned, अभी तक जो research है on stainless steel, the virus lasts for 2 days. On plastic, it lasts for 3 days. On carbon and cardboard and copper, it doesn't last that long. But even if it is there, it reduces 100-fold. So समझो 100 वायरस थे पहले, after 24 hours वो 101 वायरस हो जाएगी. So the risk is very, very less from benches and all the other things. And it's also in open air where the sun is there. Sunlight can kill 98% of the viruses within 15 minutes. So the good time if you want to go outside would be the morning time when the sun is shining, or just late evening before the sun sets. So please go for a walk, wear a mask when you go, don't go in groups, and you can use the benches and all, koi problem nahi.
Right. Wonderful. So also remember that वहाँ पर लोड कम है, पर आके डायरेक्टली अपना टी जोन छूना नहीं है.
Very true.
Right?
Yes.
Yeah. And then next question is Tulasi Ramanujacharya, what is the food that should be eaten by a COVID patient in vegetarian? Any particular diet that a patient should be given?
Yeah. Tulsi Garu, it's don't complicate things. All you need to know is make sure you drink plenty of liquids. If you're a vegetarian, try and have more protein. So more dal, more paneer, more milk, foodstuff, tofu, foodstuff from a vegetarian perspective, which will have more protein. Reduce carbohydrates. Make sure, obviously, you're a vegetarian, so you'll be having fruits and vegetables, which is a good source of vitamin C. For vitamin D, vegetables, mushrooms are one source of vitamin D, and milk, of course. You can take vitamin D supplements, but be very careful because people are suggesting very high doses of vitamin D. Things like vitamin D 3 times a day or once in or 3 times a week and all, which is just way too much. At the most, one tablet a week. But coming back to food, simplify it, reduce salt. If you have diabetes, control your sugars, have more fruits and vegetables, have more liquids, and have more protein.
Wonderful. So I think you've answered Dr. Tanjul Alam's question as well in the part of it. But what about non-vegetarians? Can we add the non-vegetarian for protein there?
Absolutely, because non-vegetarians are in an advantage because they can have a lot of options of protein from the non-veg food, and eggs are a good source of vitamin D. So go ahead. Basically, you need to ensure that you get good enough sources of vitamin C, vitamin D, B12, and magnesium. So B12 is there in any kind of non-veg kind of food. Magnesium is there in milk. It's there in nuts, walnuts specifically. So make sure you have fruits, nuts, vegetables, and if you're non-veg, have eggs as well, along with all your other protein diet. Reduce your carbs, reduce salt, reduce oil. These are standard precautions for anybody, whether you've got COVID or not. These are standard for anybody for a good lifestyle.
All right. Here's a question which is a critical question, I suppose. How should a critical care, a person who is diabetes or who's undergone a transplant, should take care of themselves?
Again, no rocket science here. Routine hygienic precautions, SMS, social distancing, mask, and sanitization, especially hand washing, rather than hand wash with soap and water rather than with alcohol-based things. You don't really need particular supplementation. Make sure your immunosuppression or whatever other basic medicines that you're taking are going on. The only difference between people who are high risk for getting severe COVID infections, and these groups include elderly people more than 65 years of age, diabetics, hypertensives, those who've got high cholesterol, post-transplant patients, malignancy patients, HIV patients, those who are on steroids or other immunosuppressants. These people have to be little more careful in the sense the threshold for admission should be lower. You don't wait for the oxygen level to fall to 90 or below. You don't wait for your breathlessness to get very bad and you feel very uncomfortable. The minute you feel even little uncomfortable, contact your primary doctor. You will be having a primary doctor and think about getting admitted into the hospital. Now, a lot of people have these negative things about hospital, but don't worry about it. Hospitals are safe. And if it's safer to be in a hospital than be at home and get into problems with your basic disease. So those who have got underlying diseases, be a little more vigilant, check your oxygen level more often, check your temperature more carefully, avoid more people as much as possible, and have a low threshold for getting admitted and contacting your doctor.
Right. So now coming to the symptoms and the testing part, there are three or four questions which I'll bunch together and ask you. One is, how soon should one get after a symptom shows up? The other person, that was from Vinay Kumar Khanna, and Hemadri Veerapuram says no symptoms, but in RT-PCR it's tested positive, but rapid antigen negative. Do I have COVID or not? Then there's one more. Yeah, Mr. Sumit Mittal is asking them. I had a fever, diagnosed positive, report shows typhoid, but I'm taking medicine for typhoid. How do I deal with this? So basically, it's all about testing.
Yeah, Jhansi, I'm sorry, I missed the first part of your question. Can you just repeat that quickly?
The first question is from Mr. Vinay Kumar Khanna. How soon one should get tested after finding a symptom?
Yeah, generally, you should wait for 3 to 5 days after getting symptoms. If you do it before that, you're likely to be false negative. So once you get the symptoms of COVID, wait for 3 days and then get it tested. If you're not too symptomatic, wait for 5 days. As far as the testing is concerned, the gold standard even today is something called the RT-PCR and a nasal swab. All the other things, the rapid antigen testing, the antibody testing, these are not the gold standard. The rapid antigen testing, even if it's positive, you might have to confirm it by doing an RT-PCR. So if you're RT-PCR positive, whether you have symptoms or not, you are considered COVID positive. And there are basically 4 categories of COVID patients. One is somebody who is asymptomatic, but positive in the RT-PCR. 2, mild symptoms, where your oxygen levels are more than 94% and respiratory rate is less than 24. Moderate COVID-19, where your oxygen levels are between 90 and 94 and your respiratory rate is more than 24. and the severe ones where your oxygen level is less than 90, or you have some other symptom like your BP is dropping, your pulse rate is very fast, or you have some stroke or chest pain or something, that puts you in the severe category. So you can be asymptomatic and still be positive for COVID. The RT-PCR is the gold standard test.
Right. So I think questions answered at one go. Next question is from Mr. Narsimharaju Ditchpalli, who's a regular participant on the show. He's asking if we are having problems with kidneys, kidney stones or infection in the urine. If they are affected with COVID-19, what are the specific precautions to be taken?
Again, like I said, Narasimha Garu, there is no rocket science, no special precautions. Just make sure that your underlying problem is controlled. If you just ignore that and focus only on COVID, the underlying problem is probably going to get worse. So if you have some urinary tract infection or you have some stones, whatever medications you're taking for that, please let that go on parallelly along with whatever COVID treatment you're taking. And I'm sorry I missed the question, answering the question about the typhoid. We have been noticing as healthcare professionals that for some reason a lot of people are testing positive. There's a test called Vidal test for typhoid, and a lot of people are testing positive for it, and they have COVID as well. I don't know, we have not yet done the research to find out whether there's a correlation between that. And most of the time these Vidal tests for typhoid are false positive. So we ignore it unless you have the typical symptoms of typhoid, of diarrhea and all that. But the gold standard for typhoid is blood culture and identifying the organism. This Vidal test is a very non-specific test, and it's coming positive in a lot of patients nowadays, and people are unnecessarily being treated for typhoid when most likely they have COVID. So I think if you have a positive COVID test and you have a positive Vidal test, which is suggestive of typhoid, treat it more as COVID rather than as typhoid.
Right. Divya Yellappu is asking this question, Ravi Garu. For a diabetic patient, on an average, how long does it take to recover from COVID? And what will be your advice for a patient after discharge, which is important? We always think that COVID is done after so and so time. But after discharge is also a critical and a crucial time. What would you suggest?
Again, like I said, I'm going to go on emphasizing this throughout this program. The underlying disease is important. Don't ignore the underlying disease. So for how long it takes to recover from COVID when you have a diabetic, it doesn't really make a difference. It all depends on how severe the infection was. If you're asymptomatic, no symptoms. If you're mild, you can recover within 7 days to 10 days to 14 days. If it's severe, then you might take 21 days, but sometimes people take even months to recover from severe COVID infections. Now, unfortunately, for COVID, one of the major treatments right now are steroids. And steroids are going to push up your sugars like crazy. So you have to be very, very, very careful about your diabetes while you're taking treatment for COVID. And this steroid therapy sometimes will go on for a month or two also, minimum for 15 days. So at that point, and it's high dose steroids, so your sugars are going to spike like anything. In fact, we've noticed that most people, even if they're non-diabetic, if they get COVID and they're on steroids, they might require insulin to control their sugars. So the precautions you have to take after discharge is monitor your sugars very carefully 3 times a day using a glucometer at home, and also monitor
diabetics.
Sorry, what's that?
Also.
No, this is for diabetics. The question is about diabetics who get COVID. Non-diabetics, if you don't have, you check once or twice if your sugars are okay, you're fine. But diabetics will have to check it 3 times a day. Probably they will have to either go on insulin if they're not on insulin, or up the dose of the insulin that they're getting at that point in time. And this monitoring will have to continue for at least 1 month, because even after you get off steroids, there will be a time period where you might still require higher doses of your medications. So nobody can tell you how long it's going to take for you to recover. Individual patients are different. But what I can tell you is how long are you infective for? So if you have asymptomatic infections, you're probably infective for 7 days approximately. If you have mild infection, you're infective for 14 days. If you have severe or moderate infection of COVID, you're infective for 21 days. That's where this quarantining and this isolation issue comes in. So, but now the ICMR and the Ministry of Health has made very clear guidelines that you need to be isolated for 17 days. It's changed. It was 14 days once upon a time, but now it's 17 days after the COVID infection.
Right. So my question here is, this is my personal question because I'm going through this. Now the community that I'm living in, as you said, 17 days of isolation. So when can we step out and when can we get back to normal lives or getting back to work, meet people and other stuff?
Yeah, it's very clear, Jhansi. Now we don't need to repeat an RT-PCR. Those recommendations are gone. So from the time of onset of symptoms or the positive, or that's the time of onset of symptoms, because the positive report will come 2 or 3 days afterwards. So from the time of onset of symptoms, count 17 days. After 17 days, you can go out, but go out only if you have to. Just unnecessarily, the social distancing norms, the masking, the hand washing, all that still continues. So if you have to go out, yes, but after 17 days. And I just want to push this answer in before the question itself. There's this confusion about quarantine and isolation. I want to clear that doubt. Isolation is when somebody has a documented infection and is kept away from other people so that they don't infect them. Whereas quarantine is when you don't have an infection, but you've been exposed to somebody who had the infection. So you're kept away from other people for 14 days to find out and wait and see if you get the disease yourself. So that's the difference between isolation and quarantine.
Exactly. And I have done 2 of them myself, actually 3 of them myself. So I understand that well. All right. So the other question is chronic asthmatic spouse. Vasudha is asking this. Doing very well on maintenance inhalers. No symptoms at all. Is this high risk for critical issues with COVID?
No. It has been proven time and time again that those who are asthmatic do not have a higher risk of getting COVID infection. But the asthma should be well controlled. And as Madam was saying, her asthma is pretty well, husband asthma is pretty well controlled. So no problem at all. In fact, there are some people who believe that asthmatics have a less risk of COVID because they're already on inhalers which contain steroids. With steroid anyway is a treatment for COVID. So you already are on a low dose of steroids. So you are already on a kind of a low dose treatment for COVID. So asthmatics do not have a higher risk of getting COVID infection. But the caveat is here that they should make sure their asthma is under control, because asthma is not under control. On top of that, if you get COVID, you have double trouble.
Yeah. And also, Allam Raipuredi is asking this question. The time gap required for vaccination for COVID positive patient after negative result. Abhi vaccine aaya nahi hai.
Yes, exactly. So the vaccine has not yet come. It's not going to come at least till 2021, in my opinion. And so no vaccine yet.
No vaccine yet. And how positive are you? How is it looking, doctor, the road ahead?
2021, not before that. Because if you want to go realistically, you have to, it's not only about the vaccine being efficacious, it's also about safety. And we already know that the AstraZeneca vaccine, which is now being touted so much in the US, it already got into problems. The patient had a very severe neurological complication because of the vaccine. Now, the last thing you want to do is when you give a vaccine to prevent a disease, then you get something else. That's the last thing you want to do. And then scientifically, you have to make sure that the vaccine is safe. And the Sputnik 5 and all the other vaccines, the Covaxin, all these things are going to take time. Even Sputnik 5, I don't really believe that it is going to be as effective and as useful as it's been touted. And Covaxin is still in the research stages. I don't expect any vaccine till before 2021. And even when it comes, it's the general public is not going to be the first people who are going to get it. The first people who are going to get it are healthcare workers and people at risk, like people more than 65, those who are on post-transplant patients, cancer patients. So general public will get it 3 or 4 months after these people. So mid-2021, in my estimation.
Right. Srinu Madarapu is asking this. A CKD patient with serum creatinine level 2.5, can he survive from COVID-19?
I've had patients on dialysis with creatinine of 10, 15 and all that, who have survived COVID, like a breeze. I've had transplant patients who have survived COVID. I've had transplant patients on dialysis, liver transplant patients on dialysis who have, who have survived COVID. So that has got nothing to do with it. Yes, the only difference is the severity might be more, so you have to be a little more vigilant and make sure your dialysis is going on appropriately. Your treatment for creatinine of 2.5 is going on appropriately. Don't miss any of those. So it doesn't make any difference. Don't worry.
Yeah. And also there's a question on what kind of dialysis patients have to take care. If they have to take care, what kind of care additionally they have to take care?
The only problem with dialysis patients is they don't have the usual symptoms of COVID, like the fever and all that thing. And also many times they have cough and breathlessness, which could be because of the kidney disease itself. And that confuses everybody. So what you have to do is be vigilant at home. Before you enter the dialysis unit, you tell the people in the dialysis unit, the technicians or the nurses, whether you have any new onset fever or cough or anything, so that they can test you, identify whether you have the virus or not. And if you have the virus, you need to be dialyzed in a separate area so that other people are not at risk. Otherwise, you don't need to take any special precautions. Ensure that you take your medications properly and ensure that you do not miss the dialysis. Because if you're scared to go to the hospital because you're scared of COVID and you try to avoid your dialysis or reduce your dialysis from the routine of 3 times a week to 2 times a week, you'll get into more problems. You'll get more immunosuppressed, you'll get more fluid overload, you'll get more infections, and you'll get into more trouble. So no specific precautions, just make sure your dialysis is done properly and be in touch with the dialysis unit and tell them about any new symptoms that you have.
Yes, doctor. And a lot of fans, जैसे हमने सुना है कि हीरोज के फैंस होते हैं, पर हमारे यहाँ पर डॉक्टर विक्टर के फैंस हैं. Lot of them are saluting you and
so nice to hear that. I'm humbled. Yes, yeah. But I can't have more fans than you, Jhansi.
Oh, my fans are different, sir. You have the real fans. My fans are from my.
By the way, my cook who got COVID at that time, she was a big fan of yours.
Oh, yeah.
She said, "Oh, Jhansi, you do."
Say hello to her on my behalf. Getting back to the questions, doctor,
yes.
Vasudha is asking, one of my uncle is affected with COVID and he got a stroke. So can we consider this as a panic stroke or a heart attack?
By stroke, you mean a weakness of one side of the body? That's what I understood by stroke. COVID itself can cause strokes. One of the presenting features of COVID infections are strokes. COVID can also present as a heart attack, and COVID patients are at a higher risk for heart attacks, because basic problem with COVID is the blood starts clotting everywhere. It can clot in the blood vessels of the heart, it can clot in the blood vessels of the brain, it can clot in the blood vessels of the limbs. So if they have a stroke, whether it's because from the heart or from the brain, it's likely to be because of COVID or accelerated because of COVID. Yeah. But the treatment would still remain the same. You have to give blood thinners. And if it's a heart attack, then you might require an angiogram to find out exactly what's happening.
All right. A lot of people are asking me, I'm trying to see, as we are running short of time, I'm trying to see and bunch questions. When can I retest and how long will the virus be with me? And when can can an asymptomatic person transmit the virus? These were the 3 questions I thought I can bunch together.
Asymptomatic person can transfer the virus. The virus, there is no need to retest, because even if the virus is dead, the test might still come positive, because the RT-PCR test looks at something called the DNA, and the DNA will persist even whether it's a live virus or a dead virus. The DNA will still be there. So now the role for retesting is gone. There's some question about reinfection. It's very, 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 very rare. There's only one documented case so far among the 28 million cases. So you don't worry about getting reinfected. Be worried about getting infected. And also, if you get infection, make sure you don't transmit it to somebody else. So like I said, till when can you shed the virus? I've already answered this question before. If it's mild or asymptomatic, if it's asymptomatic, you can shed it for 1 week. If it is mild, you can shed it for 14 days. Moderate or severe, you can shed it for up to 21 days.
Done. There are 2 important questions. I don't know if we can answer them here, but I'll put them to you in case it's not worth here. Then we can put them back onto the teleconsultative medicine. One of my family members is suffering from multiple sclerosis using immunomodulants. How does he take care? Can he use his MS tablets while he is on COVID? That is one. I'm a patient of Sjogren syndrome.
Sjogren syndrome.
Yeah, thank you so much for correcting me. So taking HCQAs 200 twice a week, is the risk of COVID low because of that?
The first question, I'm not the right person to answer that question, because it needs to bounce to your neurologist who's taking care. But from offhand knowledge, I would still think that you will need to continue your basic medications, and immunomodulatory medicines are what are anyway used for COVID, and a lot of research is going on monoclonal antibodies and immunomodulatory methods to treat COVID itself. So I don't think that should be a problem, but please check with your neurologist. What is the other question, Jhansi? The second part?
The syndrome.
Sjogren. Yeah, we're just pulling your leg to see if you remember. Yeah. So, what is the question about Sjogren syndrome?
He's already on
HCQS. HCQS, yes.
Is he at lesser risk of contracting COVID?
Well, this is something which has not been proven so far. whether HCQ is being used as prophylaxis or prevention for COVID infection. The dosing suggested is 400 milligrams once a week. So if you're already on 200 milligrams twice a week, you're already at the prophylactic dose. Whether it helps or not, theoretically, yes, it will help. But practically, we don't have enough data and enough randomized controlled trials to understand whether hydroxychloroquine prophylaxis prevents COVID infection. But a lot of doctors are taking it. I'm taking it myself.
Yeah.
So I think, yeah, as far as I'm personally concerned, you can take it. There's no harm with it as long as your ECG is normal and there's no changes there. There's no harm with taking it, and you've been taking it for so long. So probably it is protective.
Right, right. And I think time to wrap. There are a lot of questions, and today I think the questions are still continuing. But as of now, I'm running short of time. I'll have to take leave. Sorry, friends, if I couldn't ask a few questions, but there were very detailed answers from doctors. And thank you so much, Dr. Ravi Andrews. Salute to you once again for spreading positivity and giving us so much of information.
It's always a pleasure. And all of you remember, this can be beaten. You just need to be positive. Thank you all very much.
Yes, and thank you, Mr. Amol Kedare and Mr. Suchita Basu, for sharing your stories with us. I know you've been waiting, but there's so many questions which I couldn't. One last time I can see you both, Mr. Amol, you. Thank you so much.
Thank you, Doctor. Thank you, Ms Jhansi.
Thank you. Mr. Amol, thank you again.
Thank you.
It was a pleasure.
It's a pleasure.
Yeah. So thank you so much once again, all of you, to the co-victors, and to continue being the harbingers of positivity. Thank you once again. Bye-bye.
Thank you. Thank you very much.
Thank you. All right. So this is today's story. I request you to please close your videos and move on to health quiz. Time for our participants to answer the questions and win questions. So quickly, I'm asking you 3 questions for today. Type your answer in the chat box, and I'll announce who the winner is towards the end of the show. And you have to write to marketing@apollo247.com to claim your gift, and the gift will be delivered to you. The first question for today is, what is the name of Apollo's program that offers care and protection against coronavirus? I repeat the question. What is the name of Apollo's program that offers care and protection against coronavirus? Answer बहुत simple है. पता नहीं है तो आप Apollo 247 ऐप में check करके answer type कीजिए. And I'm waiting for your answers. Let me see if somebody has. Okay, answers haven't started yet. Come on, quick, type. And question number 2 for today is, which is the rarest of all the blood groups? Which is the rarest blood group in human beings? Okay. So let's see if somebody's answered. Okay, Raven, Nitin, Anil, Nagaraju, Raven, Narasimharaju garu. A lot of people have answered for first question. Let's see who the winner is in a while. And the last question for today, question number 3 coming up. Which body part cannot heal itself? Generally, body parts heal themselves, but which is that one body part which cannot heal itself? Answer पता है? नहीं तो Google करके answer कर दीजिएगा. Quickly, these are the 3 questions, and let's see who the winners are for today. Before I take leave, I thank you everybody for joining us, and don't forget to check your oxygen levels. That's a red flag. It's always good to have a pulse oximeter in hand. Here's a small AV where we can show how important oximeter is.
Some viruses can cause hypoxemia, leading to lower levels of oxygen and may cause breathlessness. Early detection of hypoxemia is essential to avoid critical conditions later. Easily keep a check of your blood oxygen levels at home. Pulse oximeter, easy, convenient, and safe.
It's always advisable to have a pulse oximeter handy and keep checking your vital statistics, especially your oxygen. And to the winners, the health quiz winners are here. Congratulations to the winners. Raven, Narasimharaju, and Mr. Madindra Singh, congratulations. You have to write to us at marketing@apollo247.com with all your details, and the gift will be delivered to you. Congratulations once again. And thank you so much, all of you, to all my experts and the doctor who has been a part of the show, and to the panel members, and to all the audience who have been so encouraging and so participating with all your questions. Thank you so much. And here's a small discount coupon that we give you. Apollo 247 is the coupon that you can use and get up to 299 rupees off on online consultation with an Apollo doctor on Apollo 247. And Medicine 10 is a gift discount coupon. You can get 10% off on pharmacy orders while booking your medicines on Apollo 247. Thank you so much, all of you, for joining us this week. And next week, we are going to debust the myths around COVID. A lot of myths are doing rounds, and we are all aware. We want right information, so we shall bust out all the COVID myths. Join us next week, 11 a.m. on Apollo 24/7's Health Hour. Thank you so much once again. Stay safe. Bye-bye.